Hi everyone, welcome to Raaonline. I am Dr. Priyadarshini Shanmugam, Professor of Microbiology. And today's class I am going to start with a case study. So the history goes like this. A healthy 22-year-old male welder who had smoked 20 cigarettes per day for 5 years. So the risk factor here is smoking. Was admitted with a 4-day flu-like illness characterized by dry cough, anorexia, that is loss of appetite. This happened 24 hours before admission. He had severe fever and rigors. Rigors means shivering, okay, and chills. So when he was examined, he had tachycardia, that is elevated heart rate, elevated respiratory rate of 40 breaths per minute. He had a low blood pressure. He was desaturating on room air, that is the oxygen saturation was only 85%. And on examining, he was cold, clammy, sweaty, he was vasodilated, and he has dullness. This dullness is on examination by percussion of the respiratory tract, okay. It showed dullness in the area where the lung is supposed to be. And he also, on auscultation, he had coarse inspiratory crackles at the left base. So we know now that there is some problem in the lungs, okay, because of which the symptoms are showing as cough and tachycardia, tachypnea, plus investigations also showed the same. Now the person's chest x-ray showed that he had an extensive left lower lobe consolidation, and consolidation is a process that occurs whenever a person has a condition known as pneumonia. Okay, so what is pneumonia? We all know that it is inflammation of the lung parenchyma, where the lung is affected by either by means of some irritants, or it can be most likely due to some infectious agent. And the usually spongy texture of the lung, or the consistency of the lung, gets converted into a solid organ like type, like the liver, okay. And in addition to it, the person also had electrocardiogram done, that is an ECG was done, showed a sinus tachycardia, and ABG, that is arterial blood gas, showed a mixed pattern of respiratory failure. So from this history, we all know that the person is having some infection, and most likely it is pertaining to the respiratory tract, and he has got a lower lobe consolidation. That means that person is having pneumonia, okay. So and we also saw what is pneumonia right now. So then going one step further, they have done some more investigations. They found that when they did a hematological investigation, that is the CBC or the blood counts, there was mild leukopenia, C-reactive protein, we call it CRP in short, it was elevated. And they also sent a blood culture for this patient, and it grew penicillin sensitive but macrolide resistant pneumococcus. So by now you will be knowing that I am going to talk to you about this organism, pneumococcus. As the name suggests itself, we know that it is some coccus, that is a spherical bacteria, which is going to cause a respiratory tract infection, a severe respiratory tract infection, that is known as pneumonia. So today's organism is Streptococcus pneumoniae, okay. For now, let us just know that it is a capsulated gram-positive diplococcus, okay. Initial name was Diplococcus pneumoniae, but then they found that this organism is very much genetically related to the genus Streptococcus. You would have heard of Streptococcus pyogenes and Streptococcus viridans. So since this organism is very much related to this other streptococci, it has been reclassified as Streptococcus pneumoniae, and the old name or the previous name was Diplococcus pneumoniae, okay. It is a capsulated gram-positive diplococcus, a very common cause of pneumonia, meningitis in the case of people belonging to all age groups. It is not restricting itself to any one particular age group. So today's lecture, we will see more about the Streptococcus pneumoniae, the diseases caused by this organism, the lab diagnosis of the same, then what are the antigens of this organism, what are the virulence factors of this organism. So that is the learning objectives for this class. So Streptococcus pneumoniae, the infections that are caused by it are pneumonia, as the name suggests. So the first infection will be pneumonia. Then there is bronchitis. This means inflammation and infection of the bronchial tree. It can cause ENT infections, that is both in the sinuses as well as in the middle ear. So middle ear infection is only known as otitis media, and sinus infection is known as sinusitis. It can also cause bacteremia. It can cause meningitis. So these are the main infections caused by Streptococcus pneumoniae, or the common name is pneumococcus. So, going on more into pneumonia, these pneumococci are the leading cause of pneumonia, and you all must be knowing that there are two types of pneumonia. One is lobar pneumonia, the other one is bronchopneumonia. In lobar pneumonia, a full lobe of the lung gets affected. Okay, it's like one segment or one lobe of the lung getting affected. Whereas in bronchopneumonia, it's patchy areas of consolidation of the lung occurring. Okay, and usually this is due to infection spreading from the bronchi. Even though pneumococci are a leading cause of bacterial pneumonia, both lobar as well as bronchopneumonia, they very rarely cause primary infections, meaning already there must be some infection or damage to the respiratory tract. In those patients, this pneumococcus can easily cause the infections. So, the pneumococcal pneumonia occurs when the normal barriers are lost. In addition to lobar and bronchopneumonia, pneumococci also cause tracheobronchitis, empyema, and parapneumonic effusion. So, there is an effusion into the pleural cavity between the two layers of the pleura, and that occurs along with the pneumonia. So, that is why it is known as parapneumonic effusion.